Hi everyone, thanks for joining. We're going to get started now. Just a reminder, 30 minutes, one question, one follow-up. Today we have Dr. Williams and Dr. Yaffe here, so I'll turn it over to them for some brief remarks.
Good afternoon, and I hope everyone had a good weekend. As usual, on Monday, we review what's happened over the weekend and since last Thursday. So with that, I'm going to hand it over to Dr. Yaffe for comments and the numbers. So over to you, Dr. Yaffe.
Okay, thank you. Since we last spoke on Thursday, Ontario has unfortunately reported record high numbers of COVID-19 cases. In the last 4 days, we've seen an additional 7,488 cases, with Sunday and today reporting over 1,900 cases each day. The 7-day average is now 1,820 cases. This is up from 1,570 cases a week ago and 1,429 cases 2 weeks ago. The majority of the cases reported since Thursday, about 84% of them, are concentrated in the regions that are in the red and lockdown levels. When broken down even further, about 56% of cases since Thursday are in the regions of Toronto and Peel. It's important to note that the lockdown measures in these two regions have only been in place for 2 weeks, so we do need more time to see the full extent of their impact. But we know how this virus operates. It needs people to transmit. So we do continue to ask everyone to please limit your trips outside of your home as much as possible to activities such as going to work or school, getting groceries, or medical appointments. In addition to the record high number of cases over the weekend, we also saw a consistently high number of tests that were processed. On both Saturday and Sunday, Ontario processed over 59,000 tests each day. Today, that number is just over 45,000 tests, but that drop is something we do typically see at the beginning of each week. Today, there are 725 people in hospital, which is up from 618 people a week ago and 507 people 2 weeks ago. We now have 213 of those patients are in the intensive care unit, up from 168 last Monday and 156 2 weeks ago. Tragically, since last Thursday, we have seen another 86 people have lost their lives to COVID-19. These trends remain concerning, and the recent data and key public health indicators for many regions in the province are very worrisome. We need to get these numbers down to protect the health and safety of Ontarians and to minimize the strain on our healthcare system. So I continue to urge people today and every day to make the right decisions to keep this virus from spreading. I will now turn it over to Dr. Williams for additional comments.
Yes, well, thank you. And excuse me, I would certainly echo those, that the trends are concerning. And we were watching with our modelers last week. We're going to have a report again, a follow-up this Thursday from Dr. Brown on how our analysis is going and the trends and directions, whether we're having impacts in certain areas or not, as well as how our trends are towards which level and how we are moving and making impacts. I think as Dr. Yaffe alluded to, these numbers in getting close to 2,000 a day, while being less than what the worst case scenario was, are still of very little comfort. And the fact that we are approaching that 2,000 number, the question is, can we hold it there? Will we be able to turn that or not, and to start bringing it down or plateauing at this level? So while we haven't gone up exponentially, nevertheless, we have gone up. And we're seeing those trends mostly in our lockdown and red zones in there. Some of the lockdown zones have not gone up as much as they used to, and we're going to monitor that case closely because they've only been at it now for 2 weeks. I know it seems a long time for those in there. We should start to see some impacts of those in the next few days ahead. But we are seeing some numbers in the outer areas as well, which is also concerning. As I alluded to last week, often we find that the risk-taking behavior, and as Dr. Yaffe alluded to, you need people to get it from people, and people in some of those other ones that have low positivity at the moment are being lax sometimes in their behavior in masking in public spaces, 6-foot distancing, mixing with a number of other people in different settings and congregate actions. And so even though the positivity means they're not seeing some impacts at the moment, all you need is a few cases to come in, and we've seen that already in some of our northern areas, and then you start to have community spread because the risk-taking behavior has not been held in abeyance. So we really need people to stick to the task, whether you're in the lockdown, the red especially, the orange zones, and even the yellow and the green zones. You have to be vigilant and maintain diligence in following all those recommendations that Dr. Yaffe has alluded to. So we need to try and get those outbreaks down. At the same time, we know that everybody's encouraged with the news of potential vaccine arriving. I will say that as it's going to arrive, it will be coming in, as General Hillier has alluded to, in Ontario in bits and pieces over the first while. So a lot of that's going to be getting our systems in place and dealing with our priority populations as they have announced and talked about today. So there's a lot of work to be done. As you heard about some of the vaccines, they do have a lot of logistical challenges with the ultra cold or frozen products and how to handle that. So there's a lot of work to get done to get ready for that. And then, of course, the movement of new vaccines, the new approvals through Health Canada with a number of different products. So a lot of work is going on by all levels at this time to move as fervently towards getting the vaccine out, but more importantly, as far as we're concerned, to make sure that what's coming out, we're satisfied through Health Canada standards it's safe and the vaccine is effective, and we want to make sure those things are in place as we move ahead and start to deal with that aspect of bringing down COVID in Ontario. So with that, and asking public to stay vigilant, I'm going to hand things over to the media for questions.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question, please.
From Cynthia Mulligan at City News. Please go ahead.
Hi there, Doctor. I'm just curious what your thoughts are about the distribution of the vaccine. I know that we're going to see frontline healthcare workers and vulnerable long-term care residents first. But after that, what would you like to see? I had one doctor suggest that perhaps it should be people in the high-risk zones, perhaps people who live in apartment buildings who, we see in neighborhoods that are suffering more than others. Would you support something like that?
Well, we are following sometimes our National Advisory Committee on Immunization, and our federal counterparts have looked at that. And so there is different tranches. So we have a phase 1, and that deals with what is determined to be the most at risk, that, as you've alluded to already, those over 80 in congregate settings. And of course, we've seen that impact on us, unfortunately, in all sectors in Ontario and other provinces and territories to that extent. We also are concerned about our healthcare workers. They're dealing mostly with contact with patients and the caregiving of those ones. We're also concerned about our Indigenous populations, especially those living in remote communities, on how to handle that as well. So we have a number of ones to consider in there, as well as the staffing in some of those large congregate settings to deal with also. So that's where we're starting from. As we look at other ones, as you're alluding to some there, there's no doubt a tiering of all those high-risk populations as we go out, and we're looking for that time when we just have lots of vaccine available to deal with everybody. But right now we're going to have to be careful in how we're rolling it out because, as I said, and as General Hillier has alluded to, it's coming out in allotments and dribs and drabs at first, and we have to utilize that in a very strict manner, and that's what the Vaccine Distribution Task Force under General Hillier is trying to ensure its delivery in a quality way and on a timely fashion, but sticking to strict criteria so that we're staying true to the task.
Okay, thank you. And somebody asked me what I thought was quite an interesting question today. If somebody has already had COVID-19, for example, a resident in long-term care who recovered from it, would they still be vaccinated?
Right now, our direction is that regardless if they've had a history of having a positive one, they would, depending on the eligibility criteria I just alluded to, they would still be eligible for vaccination because we're not too sure of those who have had a case before, how much immunity and how long it lasts for. As you noted, there has been some cases reported where people who had a documented case in the first wave have actually had another case in the second wave. So that's rare. It doesn't happen very frequently, but I think especially if you're dealing with those high-risk individuals, the other challenge with those high-risk individuals could be, and we don't know for sure, we know that from our influenza program, that when we do vaccinate them, sometimes their immune systems are not as robust as in younger people with producing high levels of antibodies. And so we still think we will cover those ones if and when their turn in the priority list comes up to handle that. So that's the information, but we're waiting for more guidance from our National Advisory Committee on Immunization, as well as what other jurisdictions are experiencing in their respective areas.
Next question.
From Rob Ferguson at the Toronto Star.
Hi,
Hi,
Rob.
doctors. I was asking General Hillier about this at the 1 o'clock news conference. He was saying, on one hand, that the Pfizer vaccines come packed in dry ice, and if you keep changing that dry ice, you're in pretty good shape. So I also don't understand why he then said they might not be able to actually take that vaccine into nursing homes. And Minister Elliott said they may have to wait to take Moderna vaccines, which don't have to be kept at cold temperatures, into nursing homes. So can you help me understand that a little bit more?
So, Rob, what we've been told by the company, by Pfizer, is that besides keeping the cold temperature, there is also a desire to limit the amount of movement because of too much movement around can also cause a deterioration in the product. So that's the physical movement, shaking, and agitation at that level as well. So that's their recommendations at this time. And of course, we have to follow what the company is saying. As I said before, if we're going to give the vaccine, we want to make sure it's as efficacious as possible. So right now, we're following the strict guidelines from the company.
Follow-up.
Okay, thank you. Now I get it. The next question is, I know Dr. Yaffe said we're only 2 weeks into the lockdown in Toronto and Peel, but these numbers keep climbing to new plateaus, it seems. And I'm wondering, absent the crystal ball that I don't think anyone has, how confident are you, and what can you point to that gives you any hope that they're not going to keep climbing?
So, Dr. Yaffe, you want to comment first, and I'll follow up?
I mean, we'll see what the modeling people say tomorrow or later this week, I mean. It is concerning, definitely. But I think, the good news is that it could have been a lot worse. The modelers were saying up to, I forget, 6,000 or 8,000 a day. We're just under 2,000, which is not good, but could be a lot worse. So we'll have to wait and see. It has just been today, I think, 2 weeks. And we hope that the numbers won't continue to go up, that in fact they'll stabilize and start to go down. But we'll have to see what the modelers say as well.
Yeah, and I would add to that is that we've had some individuals who do some of the data analysis have said they are seeing indications that the lockdown has had an effect. And as Dr. Yaffe is alluding to, we're hoping from Dr. Brown we might get some more indications there. The numbers in those lockdown areas have gone up and down by a small percent. They have not escalated at the rate they were before. They've come down a little bit from the high when we put it in, but those were quite high at the initial part. But while they've gone up a lot, and they stayed pretty well in a sort of level area, they have not gone down a lot either. But the projection was originally that they were going to continue climbing extensively over the past 2 weeks, which fortunately we haven't seen at this stage. So let's see what the modeling data shows on Thursday.
Last question, unless anyone else joins the queue.
Is from Carly Thomas at CBC News.
Hi there. This is for Dr. Williams. Today, long-term care operator Revera published a report that found governments failed to supply PPE to long-term care homes quickly enough to avoid the tragedy of the first wave. Masks were made mandatory in Ontario homes on April 8th, but many homes didn't receive supplies until April 13th. Why didn't the province act faster on this?
So, I mean, that's more of a question for the Ministry of Long-Term Care, but at the outset, as you know, we had recommendations from our national body and the rest that because of the droplet spread priority of the COVID, that surgical masks and gowns of that level were adequate. There was concerns if you're involved in aerosolizing procedures, which usually did not occur at long-term care homes, although there can be some that were there. They were all supplied with adequate surgical masks and equipment to that level. What you're noting is that when we started to mobilize and move more of the airborne type infection materials, such as the N95 mask, came in later as our supply picked up, because globally we were also dealing with a global shortage, and we had to be good stewards of that throughout the system, especially dealing with those settings that had a lot of acute care cases on aerosolizing, producing equipment, or on things with dealing with complex cases with high infection, especially in the hospitals and the intensive care units. So there was a supply of PPE, but I think what you're alluding to is that when did we open up and start supplying a lot more of the N95s, because an abundance of caution, people wanted to make sure they had it there, and so there was a decision that we would reach mutually to supply that as well, so those staff who felt they needed to have an N95 in situations, especially if there was an assessment carried out in that of a patient that could be of concern, they could have the option and could wear an N95, so that was moved on later on based on the assessment of the patient.
Follow up, and this is the last question.
Thank you. And the report by Rivera also states, managing outbreaks within residences was further complicated by inconsistent and sometimes conflicting instructions from public health authorities. Do you think that's a fair assessment, and what has been done to improve communication with long-term care homes?
Dr. Yaffe, you want me to answer that?
Well, I'll start. I think, first of all, outbreaks in long-term care have always been the bread and butter work of public health units. So public health has always taken them very seriously. It's a very vulnerable population in a congregate setting. The definition of an outbreak was switched quite early on from 2 cases to 1 case to make sure that we were as vigilant as possible. In addition, we have issued directives that have given more specific instructions both to the long-term care home and to the public health unit and others working around it. And we continue to work to improve care in that setting in terms of infection prevention and control, health and human resources, and outbreak control in general.
Thanks, everyone.
Thank you.